Thank you, Katie. And thank you all for being here with us today. I'm having a little bit of technical difficulty, so hopefully I don't freeze up during this very important conversation, which is personal to me. So 10 years ago, my daughter Samantha was born by emergency C-section 9 weeks early when my placenta ruptured, and we both nearly died. She spent 6 weeks in the NICU, and because I had employer-provided health insurance, I could spend those 6 weeks focused on my recovery and her development without having to worry about how I was going to pay those costs because I knew that I had insurance that would pay the bulk of those costs. Today, Samantha is a thriving tween, and we were among the lucky ones, but far too many mothers and babies are not so lucky. That is why, as a state legislator, as you heard, I passed the resolution to designate November Prematurity Awareness Month. I worked hard to expand Medicaid in Virginia, and I worked to create the state-based healthcare exchange because I wanted to be sure not only that we raised awareness about how to prevent premature births, but that every corner of the Commonwealth ensured that every pregnant woman had the ability to have insurance so that she could have a healthy pregnancy, a full-term birth, and a healthy child. But the United States has one of the highest preterm birth rates in the world, which is a leading cause of infant mortality and maternal mortality. So on Monday, Prematurity Awareness Day, the March of Dimes released its 2025 scorecard on the state of maternal health, and the United States received a D+ preterm birth grade for the fourth consecutive year in a row. In 2024, 10.4% of babies were born preterm, with the worst rate in the southern region of the United States. That is nearly 380,000 babies who were born prematurely in 2024, or 1 in 10. Racial disparities worsened, with preterm birth rates among babies born to Black women climbing to 14.7%, now nearly 1.5 times higher than the rate for babies overall. Babies born to moms covered by Medicaid faced a preterm birth rate of 11.7%, compared to 9.6% for private insured births. 24.5% of pregnant women did not begin care in the first trimester, the fourth straight year in a row for that decline. Now, countless factors contribute to these disparities and the preterm birth crisis, including chronic health conditions like hypertension and diabetes, smoking, unhealthy weight, and environmental factors like extreme heat and poor air quality. Pre-existing conditions like hypertension increased 6% and diabetes 8% this year among pregnant women. Women who have health insurance who can take care of those conditions before getting pregnant are less likely to have a preterm birth. Now, while 19 states saw their preterm birth rates improve, 21 states worsened, including Virginia, which maintains a C grade, but saw its preterm birth rate rise from 9.8% to 10.1%. 3 cities in Virginia earned an F: Virginia Beach, Norfolk, and Richmond. 7 localities in Virginia saw their preterm birth rates get worse: Chesterfield, Fairfax, Richmond, Loudoun, Prince William, Virginia Beach, all worse. And these statistics are likely going to get worse as millions of Americans face the prospect of losing their health insurance because of the largest Medicaid cuts in American history and the big ugly law signed in July. And now millions more are about to see their health insurance premiums spike beyond their ability to afford when the enhanced premium tax credits under the ACA expire at the end of this year. As a result, the cost of insurance will go up for everybody else. And one of the most significant factors in determining maternal health outcomes is whether or not someone has health insurance. 14% of moms are estimated to receive inadequate prenatal care, a statistic that should be 0 because they don't have health insurance. 78% of moms initiate prenatal care in the first trimester, a statistic that should be 100%. So I'm scared to see next year's report card because we already see the tea leaves. We know that these statistics will only get worse if Congress does not act. Now, I also want to remind you that these tax credits going away means that 106,000 Virginians will drop out of the Virginia marketplace, and 47,000 are estimated to remain uninsured because they won't be able to get insurance through other means. This includes countless current and future moms who have chronic conditions like hypertension or diabetes or heart disease, who can't have those conditions addressed prior to pregnancy, who will choose to forego prenatal care, including their doctor visits and screenings, because they'll be forced to choose between health insurance, paying rent, and paying their utility bills. No one plans to have a premature baby. I certainly didn't, but it can happen to anybody. And we need to make sure that those families are insured. Preterm birth is preventable, but we have to make sure that moms are healthy before they get pregnant and can get the care that they need. And when they face prematurity, they should not have to worry about who's going to pay the cost. The $70,000 average cost for a NICU bill should not be what those parents have to focus on. They should be focusing on the care their child receives, and for the mom, recovery. You are going to hear stories from people who have had to face those bills, people who are worried about moms in the future having to face those bills, and people who wonder if we are going to address the preterm birth rate and increase our grade to an A or A plus, or are we going to continue to watch our grades get worse? And with that, I'll turn it back over to Katie.